In this lesson, we're going to be talking about various infections in pregnancy and your role for providing care. Infections in pregnancy are thought to be more concerning. Now, this is because in pregnancy, the infections can easily cross the placenta and get to the baby and cause harm. So there's a potential for the infection to be transmitted to the baby. And it can reach that baby during delivery or during the pregnancy and cross the placenta. These infections can be really, really harmful. So let's talk about these infections. Torch is a mnemonic, just to help remember the list of them. And it's going to stand the T for toxoplasmosis. O is other, so it's basically going to be everything else from these. R is rubella. C is cytomegalovirus, also known as CMV or CMV. And then the H is herpes. Some examples of our other are going to be group beta strep or GBS, HIV, syphilis. So just the other things. And we'll go into more of those. And those are just a few examples. All right, so now we'll break down the torch. So we'll look at them in more detail. The toxoplasmosis, which was our T, is coming from cat litter. It's a parasitic disease and it's transmitted to the mother from the cat litter. So for this reason, we need to tell mom that she should not change cat litter or deal with it at all. This can cause neurological problems for the baby. Other is our infection that, remember, is just everything else. So this could be various things. So just a few big ones to know are group beta strep or GBS, HIV, syphilis, and hepatitis. So for these, I want to explain GBS in a little bit more detail because that's a big one, as well as HIV. So GBS is a bacteria, beta strep bacteria, and it is found in the vagina of all women. Okay, so everybody has this. And a vaginal swab is taken on each patient when they get to between 34 and 37 weeks. So this swab is then cultured and the bacteria is detected. If it's above a certain threshold, then they're said to be GBS positive. And if they aren't at that threshold, then they're GBS negative. So negative doesn't mean it's not there. It just means that they're not at the high cultured numbers. So for this reason, if the mom is GBS positive, then we know when she comes into labor, hopefully, as long as she's had the test done already. And she is going to be given penicillin while she is in labor. And that's going to help kill off some of that bacteria. The reason why we do this is because if that baby passes through that birth canal and gets that GBS bacteria, then they can get septic and very sick. So this will cause sepsis in the newborn. Now, of course, if a mom's GBS negative, she won't be getting the penicillin. It's not that we won't watch those babies because remember that bacteria is there. It's just that the positive is a high amount of the bacteria. And then HIV. So another big one I just want to touch on. HIV is a big to know that these patients will deliver by a C-section, and it's to limit the transmission exposure. They're more likely to get exposed if they pass through the vagina. So they'll have a C-section. The infants are going to be given the antiretrovirals after delivery, just prophylactically, since we're not going to know yet if they have HIV or not. And they cannot breastfeed because it also can pass through the breast milk. So they need to bottle feed. So those are the big things to know with those. Rubella. So this one is usually something we are vaccinated for. So we draw titers on the mom. And if she'll either be immune or non-immune. If she's not immune, then we worry about that the baby could, if mom gets rubella during the pregnancy, the baby could have a bunch of congenital anomalies. So even death can occur. So we can't really protect mom in the current pregnancy because the vaccine is live. So we have to give her the vaccine when she's postpartum. So after she's had the fetus or delivered the baby, she'll get the vaccine. We never give live vaccines in pregnancy because they can cross the placenta and then they'll cause all these problems. So if she's not immune, we're going to give her the vaccine following delivery to protect her in future pregnancies and also protect other people so that if she does get rubella, she doesn't pass it on to somebody else that's rubella non-immune. So we'll draw titers. We want to see immune. If she's not immune, she'll get the live vaccine. Our other two are C and our H of our torch. So cytomegalovirus, also known as CMV, with this one, it is transmitted through bodily fluids. So patients often feel like they just have a cold, but they actually have CMV. CMV can be transmitted through the placenta. So we're going to be concerned about the baby with this one big time. So issues with CMV are just IUGR. They could be growth restricted and not grow as big. They could have seizures, blindness, hepatomegaly, splenomegaly, jaundice, hearing loss, microencephaly, and even death. So a big range of items there. The big problem with this one is it's often passed in daycares. And you can imagine if you are a parent that is pregnant and already have a child in a daycare, that this can happen frequently. So we had a nurse on my unit whose daughter was in daycare and she was pregnant and got really, really sick and they couldn't figure it out. They thought she had mono and she was hospitalized for mono, and she did have mono, but she also had CMV. And her baby, she had to undergo all these tests during pregnancy. And everything turned out okay for her, thankfully, because they figured out it wasn't her first time exposure, but her second exposure. So meaning she had had CMV previously. So thankfully she lucked out, but it can cause all of these items to occur, and it just shows up kind of like a regular old cold. All right, herpes. So for herpes, this one is we're watching for lesions. The patient's going to be treated with acyclovir and a C-section if there's active lesions. So let's talk about this one a little bit. Patients will be prophylactically treated with acyclovir, and that's going to happen around 36 weeks that they'll start getting this prophylactic treatment. So not all patients, people that have had lesions in the past, that have had herpes in the past, will get acyclovir, even if there's no active lesion. So they'll take acyclovir, and that is just to prevent, because there could be a lesion that's not detected. And with herpes, death to the fetus or baby can occur, and neurological issues. So we really want to try to prevent and make sure this doesn't go undetected. A C-section, because if there is or are lesions at all present in the vagina, then the baby's going to pass through those lesions, and we don't want that because then the baby can get herpes far easier. So we will do a C-section if there's any active lesions. For assessments, we need to look at maternal labs. So what is her rubella status? So drawing the rubella titer. We also want to know what is her HIV status. We'll draw syphilis. We want to know her RPR for that. Hepatitis, just so we know all of her labs and what we need to do. Then on the baby assessment. So when the baby's born, we are going to be looking if mom had herpes, for any skin lesions, taking birth measurements to make sure we don't have any IUGR, that neurologically the head is measuring okay, the head circumference. And that'll be with our brain, for our brain measurements, the head circumference. The other thing is that if the baby is growing properly and is IUGR and the brain measurements, we'll do this to ensure that there's neurologically no compromise showing. All right, let's talk about our therapeutic management. So what are we going to do for this patient? So treatment is going to obviously depend on what the infection is, like what are we battling here. So medications that can be given or will be given for different things are the antiretrovirals. which, if you remember, this was for our HIV. Antibiotics. This one is for things like our GBS, getting the penicillin, or even syphilis. They'll be treated with penicillin as well. Antivirals and monitoring. So for monitoring with our therapeutic management, we just want to make sure that measurements are going okay for the fetus, because that's a big clue that something's wrong. And then also doing those non-stress tests to make sure that the fetus is doing okay, and ultrasounds just to get a better look at the baby and look at the blood flow to the baby. Education for these patients is going to revolve around ensuring that the mother never changes cat litter, right? If you remember, that's our toxoplasmosis. So we want to make sure she's never changing cat litter. STD protection. So we want to ensure that STDs are not transmitted. And those are going to be our things like our herpes, syphilis, hepatitis, HIV, and then proper hand hygiene so that we are just limiting exposure to things like CMV. Our nursing concepts for infections and pregnancy are going to be infection control, reproduction, and human development. We need the patient to avoid certain infections and have proper human development. Our key points to remember for our mnemonic TORCH are going to be what it stands for. So TORCH is our toxoplasmosis, other, rubella, cytomegalovirus, and herpes. It's important to remember that they can cross the placenta and that'll cause harm to the fetus. And then our treatment is going to vary based on the infection. Make sure you check out the resources that are attached to this lesson. Review the TORCH mnemonic. Now go out and be your best selves today. And as always, happy nursing.